let's take baseball for an example. Visual acuity, dynamic visual acuity is so important. The average vision for an MLB player is 20/12, right? So if you think 20/20 is what normal patients see, like let's say me and you, that means that they can see what we see from 10 or 12 feet, they can see that from 20 feet. So they have an 8 to 10 feet advantage in vision, which is huge. And so we want to get our athlete as close as possible to that. So that's step one, is show them the data, show them where should they be at. So we like to do a comparative analysis. So if they're in high school, we'll try to give them high school metrics of someone who's going into D1 schools. Like, okay, this is where you're at. You get a certain grade level compared to where you want to be. You know, you want a D1 scholarship. Okay, this is where you should be at. Whether we're measuring agility, whether we're measuring, like with NeuroTracker, multi-object recognition, every single skill that we do a comparative analysis on where they want to be to where they're at. And that already tells them, you know, kind of that difference of this is the gap that you need to make up. So, you may not be perfect, there's room for improvement. So that already shows them data-driven decision, like, okay, objectively, this is where you're at, objectively, this is where we want you to go. And that helps them bridge the gap when we explain, okay, this isn't just a one organ thing. This is multisensory, right? The brain controls your whole body and your ability to perform. And so that helps, I feel, get that conversation going. Because otherwise, if I start talking about the brain's ability to do something or how neurocognitively they need to work on this or that, I don't see that translating that the data-driven adjustments that you guys make, uh, to me felt like objectively I can show this to a patient and show how they're getting better. And if I can get those results even quicker, then that's what I need. So that's when we brought it in, and we've had some great success with our concussion patients with it. And I know a lot of athletes use it, especially in Europe with soccer.